Welcome to Leadership Unleashed, the show that will explore the multifaceted world of leadership through insightful interviews, thought-provoking discussions, and practical advice from leaders throughout Westchester County and beyond. I'm your host, Dr. Marsha Gordon, President and CEO of the Business Council of Westchester. Today's episode of Leadership Unleashed features a visionary healthcare leader, Dr. David Lubarsky, President and CEO of the Westchester Medical Center Health Network. A nationally recognized physician and executive, Dr. Lubarsky leads a 1,700-bed regional system delivering advanced trauma, pediatric, and surgical care across the Hudson Valley. With a career spanning top academic medical centers, including UC Davis Health, he is known for combining innovation, equity, and operational excellence to expand access and improve outcomes. Now, at WMCHealth, he's guiding the system through a bold era of transformation and investment in the region's health. Before we dive in, we also want to thank Westchester Medical Center for their support as the premier sponsor of the Leadership Unleashed podcast. Welcome, Dr. Lubarsky. Welcome back to Westchester.
Well, thank you very much for the invitation and the opportunity to be here.
So let's start at the beginning. What drew you to a WMC Health? And how do you see the system's role evolving in the communities that you serve across the Hudson Valley?
Well, what drew me here was the fact that I grew up here. So graduate of Edgemont High School, class of 77, and grew up in Edgemont, and family still lives here, and friends still live here, and it's home.
I was going to say, is it home?
It's home.
Mm-hmm. Yeah, that must feel good to come back to.
It was. The other day I was out actually on the Bronx River Parkway on my bike, and I still remember doing that 40 years ago when I was in school and catching a good Sunday morning breeze. So that was it was a blast from the past. So
let's talk about where WMC Health stands now and a little bit about how the health system has evolved and how you see it evolving across the communities you serve. And what communities do you serve?
Well, I'm not sure everybody really realizes how widespread the care is. We have about 400,000 individual patients who come into the system. Yes. Wow. Who see us every year, and that's not visits, that's individual human beings, across 9 different counties, including Suffern and Suffern, where Good Salmon is one of our bigger places, but, all the way up through Poughkeepsie. So, we're to the left of the Hudson, we're 2/3 of the way to Albany, and a bunch of different places in between, like Kingston and off to the left in Delaware County and Margaretville. So our reach is very, very big, and we provide some really unique services.
Let's talk about those.
Yeah, it's so we're the largest provider of Medicaid services north of New York City.
Very important.
In the state of New York, and so we take care of a lot of underserved communities. That's number one.
Thank you.
And that is actually what we're here for. That is our mission, is to take care of everybody at an extremely high level of care without regard to their ability to pay. Having said that, the way that we do manage to pay all of our bills is we do things that no one else in the region does. We're the only level 1 trauma center for both kids and adults between New York City and Albany. We're the only academic medical center. We're the only transplant center. Mm-hmm. We do half the pediatric inpatient admissions at Maria Ferrari.
At Maria Ferrari,
yeah,
yes.
In the entire Hudson Valley. We're the only burn center for kids and adults between New York City and Montreal. It is truly a privilege, actually, to be such a bedrock part of the health care needs of a large area.
Well, and I know that you do it so well. You've always done it so well, but it seems that in recent years, and certainly I'm sure under your leadership, it's grown. Your reach has grown across the region, where people used to, I lived in Dutchess County for many, many years, and everybody would go to Westchester Medical Center, and now Westchester Medical Center is there.
Yes.
And that makes a difference because people want health care, I think, and you can correct me if I'm wrong, close to where they live.
Everybody actually does want the same thing, right? Which is great care, where they want it, when they want it, how they want it. And that differs for individuals. Some people really love a digital interface and don't want to be bothered to sit in a doctor's office. Some people want self-service and want to schedule their own appointments. And other people still want to pick up the telephone and trundle into the doctor's office and sit in the waiting room for a little bit and be part of that routine. So making sure that we offer access points that meet the needs of every patient and that we manage to deliver really great care no matter how they're accessing the system. That's part of the challenge and part of the joy of working here.
Well, how wonderful. And in this era of rapid healthcare transformation, as the leader of the system now, how do you lead a health system through change while keeping patients, staff? I know that's always a challenge, right? Staffing and the community at the center, at the heart of what you do.
That is the biggest challenge in the world, which is to empower and engage the people who work in the healthcare system. Because if they're happy and they buy into the vision and the mission of the organization, you actually don't have to do very much other than that, right? Because people are generally good at heart. They're generally good and hard workers, but they have to feel like they matter and what they do matters. And when they do that, patients get great care. I'm very proud that the organization I left, UC Davis, we were the public health system that was number one in the U.S. to work for. And I'm planning on bringing that exact ethic here. And there's not much to it in the sense that hopefully as a leader, you build trust. And when you have trust, you build the engagement and the empowerment of your workers that you're going to back them up and you're going to give them the tools to do a great job, and they're going to do it.
Well, how fortunate for us that you have that background. So you're coming back home, but you're bringing back home with you what you've learned elsewhere to help our home be a better healthcare provider and healthcare experience and healthcare educator. I want to say each year I go to I know it's a February event where we learn about women's heart health. And I've talked to people, I've learned so much, it's almost ingrained in my head. These women have heart attacks in different ways. It feels different. This is what you should be thinking of. And a friend of mine recently complained to me about some heartburn. And I said, or some indigestion. And I said, maybe you should go get a check because I was at that event at the Westchester Medical Center, and I learned so much. And you should get it checked. And she was fine, by the way, luckily. But your outreach into all communities and into the community is so very, very important. And the things you support is so important.
Yeah, at a time like this, when frankly a lot of public health funding and public health itself is a little bit under attack and the wisdom of experts questioned, I think there's a great place for medical centers, which have labored as Westchester Medical Center has for half a century, right, or more, right, delivering care and being there for people and being a voice to help educate them about how to take better care of themselves is more important than ever. And I'm glad that you went to hear that. I'm a visiting distinguished professor at New York Medical College, our partner.
Yes, wonderful.
And still a professor at both UC Davis and at the University of Miami. I carry emeritus titles. So I'm an educator at heart, and I'm a physician at heart. And I hope I bring those things also, most importantly, to Westchester, which is, a focus on taking really great care of patients as the number one job, but also communicating to the public how they can take care of themselves and their loved ones.
That's right. Well, we thank you. We thank you so much, Dr. Lubarsky. This has already been such an insightful conversation on leadership and the evolution of WMC Health. We're going to take a quick break, but don't go anywhere. You're listening to Leadership Unleashed on the BCW Podcast Network. I'm Marsha Gordon, the President and CEO of the Business Council of Westchester. talking to Dr. David Lubarsky, the president and CEO of the Westchester Medical Center Health Network. We'll be right back.
A lot goes into planning a birthday. For my daughter Cameron, it started with a stem cell transplant to cure her sickle cell disease. Yes, cure. Westchester Medical Center Health Network uses every technology, technique, and talented specialist to conquer diseases that could otherwise rob a child of childhood, helping my daughter and thousands of others at Maria Ferreri Children's Hospital. Happy birthday, Cameron.
Happy birthday to
WMCHealth, advancing care here.
We're back on the BCW Podcast Network. You're listening to Leadership Unleashed, and we're continuing our conversation on healthcare and leadership with Dr. David Lubarsky, President and CEO of WMCHealth. Dr. Lubarsky, you've led some large academic medical centers. What foundational leadership values do you carry with you into every role?
Well, it's also almost become trite to say you're a servant leader, but I'm sorry, I'm a servant leader. And imperfect as I am, I really do try to make sure that my team and everybody in the organization knows that I'm there to work for them, to make it easier for them to do their job taking care of patients. And always going into work knowing that you're there to help everybody else is really key. They're not there to serve you. You really are there to serve them. And then in turn, when you do that for them, they know they're really there to serve the patients, right? So it flows downhill like gravity. You know, it's great.
It's a great way. It's a great leadership lesson. We are all servant leaders in a way. And I think certainly in healthcare, that's top of the totem pole. So thank you so much. What's something about WMC Health that you think the public doesn't fully understand, but should?
Well, I don't think they understand that we are truly a pillar and a keystone for the entire healthcare ecosystem of the Hudson Valley. We get almost 14,000 inpatient transfers from the other hospitals in the region. That's an inconceivable number when you think about it. That's 14,000 people who have complex disease, who needed care at a specialized organization like we have. And our door is always open. Doesn't matter if you have Medicaid, doesn't matter if you have no insurance, doesn't matter if you have commercial insurance, because you're going to get great care no matter who you are and no matter what's wrong with you. Our patient mix is the most complex between New York City and Canada. Right? Nobody else takes care of sicker patients. Nobody gets more transfers than Westchester. And we are, really, really good about accepting transfers from all of the outlying hospitals, but especially our own affiliates, where we've elevated the level of care, not only because of what they can send us, but the fact that we're investing in sending up our subspecialists that maybe a community could not afford to support full time. But because they work for us full time, we can ask them to work up there full time or part time, excuse me.
Right.
And that way we expand the level of care and we upskill the quality of care that is being provided at all of the region's hospitals that are associated with us. We have 9 different facilities, and everybody in every community, right, deserves access to a really good GYN oncologist or an ear, nose, and throat doctor or an allergist. So really working to expand our subspecialty presence in other communities is part of my challenge these days, and I'm working hard on that.
That's a great challenge. And I know the health system has grown. You have new buildings, you have new opportunities. Can we talk a little bit about that?
Sure. I want to give great credit to Mike Israel, my predecessor, was at the helm for 20 years. He had the foresight to begin and start construction on a critical care tower. Westchester Medical Center itself will now add 128 new ICU beds to the mix.
128 new ICU beds.
Yep. And that's important because we are totally filled every day. Our ICUs are virtually at 100% capacity every day. And that's because we take care of all these really sick patients who are being transferred into us. So that will just simply make us a better partner and a better hub, if you will, for complex care in the region. So I'm very, very excited about that. It's going to elevate just the facility where when people work in a new place and patients are taken care of in a new roomier ICU room with higher technology, and it's easier to apply things like AI across their institution when everything is wired perfectly well.
That's right.
It's just going to be great. So, and that's opening up, we hope, in about a year and a half.
Very exciting. Yeah. It's very, very, very exciting. And it's welcome to those people and the families that are with their loved ones in ICUs at difficult times. And it just is so much more pleasant.
It is. Not all of our current ICUs have the uplifting light and architectural features that match the incredible skill of our practitioners. I mean, we often talk about the doctors, but our cardiothoracic ICU nurses just won a national award for being among the best in the nation, because at the end of the day, nurses really probably primarily matter to the outcomes in the hospital.
Yes.
So giving them a nice place to work.
We love our nurses.
We love our nurses.
Yes.
And giving them a nice place to work in a nicer, newer facility will just make them happier to be there.
And I've noticed also that everyone across the WMC system, when you pull up, when you walk in, there's a smiling face, there's a friendly face, there are people that care for your patients, and that gives great comfort because it can be scary to walk into a hospital.
For sure, right? It's not only you're worried about what's going to happen, it's the fact that you've lost control. You walk in, you're putting your life in someone else's hand. You're actually putting your clothes in a locker sometimes. You're wearing a gown that is, I've never understood who made those things, but they're not flattering. And you're trusting people. You have to trust people. And the first thing is that before people care how much you know, they have to know how much you care. And that is why a smiling face and everything else and a hand on your shoulder and just a little bit of patience to let you tell your story goes pretty far, like farther than most medications in terms of making you feel better.
So I think that when we talk about leadership being unleashed, some things are so basic and so true to a good human spirit, which is what you have at WMCHealth, and which surely you're going to build upon, because I think it's your value, and that's very, very, very important. We thank you for that. Dr. Lubarsky, thank you for sharing your insights and perspectives so far. We're going to take one more short break, but when we return, we'll dive deeper into your vision, legacy, and advice for the next generation of leaders. So stay with us. This is Leadership Unleashed on the BCW Podcast Network.
This is the coming home you dream about.
But getting here was unimaginable.
At 25 weeks, I was hemorrhaging badly, losing amniotic fluid. Fortunately, I was taken to Westchester Medical Center, where they have the most advanced care in the Hudson Valley for high-risk pregnancies and premature babies. And because we were there, now we're here.
WMC Health, advancing care here.
Welcome back to the BCW Podcast Network. This is Leadership Unleashed. I'm Marsha Gordon. I'm President and CEO of the Business Council Westchester. And we're back with Dr. David Lubarsky, President and CEO of WMCHealth. So a couple of things I just want to talk to you about. How could we not talk about health these days without talking about AI?
Yeah, you can't, because honestly, it's the future of medicine. When you think about AI, first of all, it's not artificial intelligence. It's augmented intelligence.
Love
because,
that.
Yeah, it's the way you use it, right, is to make you smarter, right? It's no different. I used to use Google to look up facts, and they were very disjointed. Now, I use ChatGPT, but I don't absolutely rely on it because, like all things, there's imperfections and errors, right? So at the end of the day, the doctor and the nurse are ultimately responsible for using intelligence and augmented intelligence wisely. And then secondarily, you have to understand that AI can do things that human beings cannot do. And for example, and sitting in front of me is my iPhone. it recognizes my face. Like, I'll probably walk down the street a year from now and say, wow, I saw Dr. Marsha Gordon, or maybe that was her. Maybe it wasn't her. There's a 1 in a million chance that the iPhone will open to a different face. Pattern recognition is solved. And using that, especially when you're like following up x-rays and following up lung nodules and following up people with aneurysms, it can scan 1 million charts and recognize who has a progression of disease that might require a visit that, wasn't immediately apparent to someone else. It's amazing. And employing it in that regard, right, is pretty safe. It's also really, really safe to say, hey, I want you to search in my medical records everybody who didn't have their follow-up colonoscopy in time, and print me out a list of 4,000 people out of the 4 million in the database. I mean, a human being can't do that.
It's incredible.
There's a but, right? And the but is, I don't want it saying and sending out stormtroopers to bring in that person to get their colonoscopy against their will, right?
Right.
We don't want to get to Skynet and Arnold Schwarzenegger, right, and Terminator. What we want human beings to make the interpretations, to make the decision calls, to make the judgment calls, informed by the best information that they have. We don't want to give up our autonomy and decision-making to what is clearly not a perfect system. And it will never be a perfect system without human compassion thrown in.
Yes, and that's so true. What I love, and when I think about AI in medicine, from what I understand, I think the idea of a doctor not having to sit and take notes, and be interacting with the patient instead, is very, very exciting.
It's liberating. I actually rolled out ambient listening and note-taking at UC Davis right before I left here. And as one of my physicians said to me, oh my God, you've brought the joy back into medicine. And we again, like if you're doing AI, you better do it with clear implementation validity checks. So more than 90% of the notes that were generated, even though we were read word by word, more than 90% did not require a single word change for either completeness or accuracy. And where they did, of course, the doctor made the change. But the mental energy for each patient visit was cut almost in half because they weren't busy thinking, am I capturing what the patient's saying? And then typing, and not everybody's a perfect typist as a physician. Mm-hmm. And they're typing in furiously, and they're not looking at the patient, and they're not gauging their reactions. So they enjoyed interacting with the patient. What's more important, the patient, more than half of them said it markedly elevated.
That's very interesting.
Their experience in the clinic.
That's
all good.
Interesting. We will have to do a whole other podcast on this. Let me ask you something else. We are recording this at the end of June, but we're probably going to be listening in September. September is back to school. What should people be thinking about as the new school year rolls around?
Share your candy, not your diseases. Mm-hmm. It seems at a time like this, I never thought I would have to say this, but, vaccines work. They're part of social good. They make sure that you're making sure your kids are vaccinated. They don't get sick and suffer. And they also make sure that they don't spread diseases to people who can't get vaccinated. So there are some people who are immunocompromised or for whatever reason are allergic that can't get the vaccine.
Yep.
We have to make sure that we keep up herd immunity and that everybody is vaccinated, and the entire good and health of our nation depends on that.
Thank you. What legacy, Doctor, do you hope to begin as a leader? We're not leaving yet, not just for WMC Health, but for the region.
I think, and I'm sorry to my colleagues who will disagree, I think that leaders in healthcare should always be physicians, and that you should make sure that you're leading with a physician's heart and that you're putting patients first and that you are absolutely 100% committed to doing right by patients. That's it.
Well, we thank you, Doctor. We welcome you so warmly to the Business Council of Westchester, to Westchester County, to the Hudson Valley, back home to New York. And we thank you for joining us today on Leadership Unleashed. Your visionary leadership and your deep commitment to community-centered care are making a lasting impact on the future of healthcare across the entire Hudson Valley and beyond. And again, thank you to Westchester Medical Center for your support
and to our listeners for tuning in. We'll see you next time on Leadership Unleashed.
Be sure to check out the BCW Podcast Network's expansive lineup of shows: Leadership Unleashed, What's Trending, Advocacy and Politics Unplugged, The Member Spotlight, and Nonprofit Voices of Impact. The Business Council of Westchester is the county's largest business membership organization focusing on economic development and advocacy. With over 1,100 members, it is our mission to work for the profitability of our members and the prosperity of the Westchester community. To learn more, go to thebcw.org.